We are now recording. So, for those who will be watching this later, the panel has voted to record the meetings. So we will proceed on with the agenda from here. I was told that Ben, you want to address the mission statement.
No, I think I just had questions about it. Dale, I know you sent the email, but we were in a meeting and Dale provided me with a copy of the mission and purpose just prior to me coming down and preparing for this meeting. I've reviewed it, but I don't have any questions today.
Okay. All right. Well, we will move on. Community statement released regarding the formation of the task force. So this was at the last task force meeting, we had a question about why we were formed. And so some discussion had taken place about how well we answered that question. And then I think probably most have seen the social media posts on the same topic of why we exist and what we're doing and et cetera. So the question then came about, do we want to put out a statement as a task force as to what our purpose is in a public manner and what our focus is. There's a general belief when you read some of the social media stuff that we were brought about for the purposes of mandates and face mask mandates and stay-at-home orders and things that is not in any way focus of this group. And I think that's part of what's got the public concerned. Maybe that might help if we made a release as to what that was. And partially it may be falling on me because I think there's some belief out there that I encouraged the aldermen to put their mandate on, which is not true. I didn't involve myself in that. But what is the overall opinion of the task force regarding some kind of public statement as to why we exist?
On that, just as an elected person in public relations, I think communication about your purpose is very useful. I think that the timing of this task force in relation to the executive order from the city of Marshfield, it may have seemed curious to the public, and I think some clarification, like you just stated, may be very useful in communicating separation from what people may have joined together as a singular purpose as the formation of the task force and the coincidence in relation in time to the executive order from the city of Marshfield. And so I think that would distill maybe some negative belief or ideas that exist. I also believe that being open like this and clear in our communication will soothe anybody that feels concerned or anxious about why we're here and what's going to happen with this task force. So that's my opinion.
Does anybody else have anything they want to input on that?
Well, as we sit and talk to Michael, and that's one of the things we brought up. I think it's very important for us to be very upfront with some of the conflict that's happened in the past, because that's what's being used to try to disrupt anything productive of happening. So I'm absolutely positively for it and get it out there and set the mission. We've been very specific with this task force to set our goals, our objectives, and our mission. And I think it's important for us to make sure everybody knows what them are.
Okay.
Yes, I agree. I think we ought to get it out there.
Does anybody have a difference of opinion?
I agree with Ben and Fred both. I think, and Mark, I think we need to have it out to the public.
Thank you, Dr. Alexander. Does anybody have a difference of opinion? Okay, well, we can rather than today, because we do have some things to work through, maybe we can come up with some drafts and bring them back to our next meeting so that we can look at them and see, and then present them to the commission, see if they agree with it, and then maybe we can make a release sometime in the next week. Does that sound good?
Yes.
Yes.
Sounds good.
Okay, so reports from various disciplines would be the next thing on the agenda. And we'll just kind of, I'll start. I did send out some messages to the chiefs and asked them to report anything that they had or had any issues or concerns. As of meeting time, I have not received anything back from the local fire chiefs. I can tell you from from Marshville Fire standpoint, we're still seeing, we're still running calls that involve COVID. We're still seeing that on a weekly basis. We're still working very hard to keep our people protected as well as we can, and PPE is solid right now, and we're able to do that. From a coroner standpoint, we unfortunately are still seeing some deaths. I did run a COVID-related decedent over the weekend. Did have a lot of comorbidities, but nevertheless, COVID was the definite contributing factor in this person being deceased. So I'll just kind of go down our list. If you have nothing to report, that's fine, but we'll just move along down to Fred Savage from Cox EMS.
Yep, from last week's update, we have no current employees in Webster County on the EMS side of it that are positive or quarantined. So we're up to we're full 100% ready to go here. However, we're seeing as many, if not more, COVID positive transports and hospitalizations than we've ever seen. So it's all day, every day for us on the EMS side of it. But so far, like I said, we're 100% staffed. We're 100% up to our shift capabilities, and we're covering a high volume of calls.
Okay. Dr. Alexander, would you want to speak on what your experience is in the ER and what you're seeing?
We are still on an upswing. I've been off a day or two, so I don't have the current numbers, but they're expecting a peak in the next couple weeks. Hopefully we'll level off. The part of our mission statement, I don't know if maybe even just some encouragement. I know Dr. Robinson had talked about trying to get people to take the vaccine. It is going to make a pretty big difference if we can start getting some herd immunity out there where people are able to get some antibodies and prevent them from getting this disease. We're doing much better than we were last spring as far as knowing how to treat these people. So the mortality has dropped, but there's still a lot of people coming in, and I see quite a few people just because of my involvement with Webster County. I just, in my mind, every time I see someone from Webster County, I just think of what we're doing, and I'm seeing quite a few people still coming in from Webster County and all the surrounding counties. And so we need to really encourage the PPE. Out of a group of, there's 39 physicians in our group, and we're just inundated with COVID every day. And I'm really impressed with the difference the PPE has made. We've had 2 physicians in this almost year period of time that have contracted the disease. And like I said, we're surrounded by it. The PPE is working, and the social distancing along with PPE keeps people safe. Most people aren't going to die now, but we see people getting pretty ill, and of course, the older they are and the more other medical problems they have, the more likely it is that they're going to have a tougher outcome. And it's not fun. I see people coming back 3-4 weeks after they've cleared the virus, and they're still having all kinds of health issues. And so I don't know if the papers would allow it, but I would be willing to, maybe put some information just from a physician point, and maybe Dennis, Dr. Robinson would be willing to kind of help me with that. And maybe we can make like a public service announcement or something like that, just to encourage people and kind of allay their fears. I'm going to take the vaccine as soon as it's available. I'm top of the list. I'm the oldest in our group, and if it comes out in the next week or two, I should be right at the top of the list if, once the supplies occur. And I'll let everyone know if I grow another nose in my forehead or something else. If something strange happens, I'll be the first to say it, but I'm not afraid of taking the vaccine. But that's about all I have to say. I'll give the floor back.
Thank you, Dr. Alexander. Commissioner Fraker, are you able to speak yet? Okay. Dr. Robinson.
I just know we completed our vaccine storage agreement with the state, and we're all set up and ready to go. It sounds like next week the first few doses are going to trickle out. And I'm excited because I'm like Dr. Alexander. I'm going to take it first, and I've told my patients if I live, then you need to take it, because, I mean, even the people who have made it through the COVID have some pretty bad horror stories to tell, which, that's all I think about. But most people don't get that sick, and it's not that big of a deal. But the ones that do say it was pretty miserable.
Okay.
And I think I'd rather be dead than be on a ventilator for 3 or 4 weeks, go through all that stuff. So I'm going to take the vaccine. I encourage everyone to do it. So we do need to push that. And I think some of the stuff that we need to, get them to do their part, not be afraid to set a good example. But it's coming. There's going to be a gap. I know they say there's going to be a window where we have vaccine, and then it'll be a month or two before we get it again. So they already planned on that between phase 1 and phase 2. So if you get an opportunity to do it, you need to do it then, because it might not be there the next time for a few weeks.
Okay.
Doctors, not to cut into your time, but I was concerned. I know the majority of people I've talked to, even in EMS and healthcare, RNs, nurses, everybody's concerned about this shot. And so this vaccination. So I watched Dr. Troutman's video yesterday. It's an 8-minute video, but it answered so many questions for me in my mind that I, like you, have no problem. I'll step up, I'll take the shot today if you get me one. So I think that would pay dividends if there's some way we could get authorization or whatever to have that video put together. Like you said, if you guys want to make a statement to Dr. Alexander, Dr. Robinson, and put that information, because it really was, for me, it was a very, very informative 8-minute video that explained the vessel of the vaccination and the protein spikes of the vaccination, and it really put it all together to make me very comfortable with it.
So I would think most of the time they put these videos out on the Facebook page for Cox Health. I've already talked with them regarding allowing the health unit here in Webster County to put links on their Facebook page and websites to these instructional videos, and it's everything from the importance of masking and social distancing to what Fred was saying about the vaccine. It is very informative, and so I mean, I would suggest we take a look at the Facebook page and then provide a link to it so that folks can see it, and there would be no problems from Cox Health's perspective to do that. So if it's not there, it will be, but if it doesn't show up within a day or two, let me know and I'll talk to them specifically about sending a link to the video down. Because the whole purpose of it is for education. As Fred says, there's some concern, obviously, with the way the media treated this whole thing for the entire summer. There was a lot of concern that there was steps skipped and that kind of thing, and really there wasn't. They just ran some early phase steps simultaneously, which is not the first time that's happened. It's happened before. But it certainly provides strength to those phase 3 studies, which were just finalized, and the outcomes in those phase 3 studies are very remarkable. From the vaccine perspective, I mean, most years flu was, between 55 and 75% effective, and we have 2 that are over 90%, which is really quite amazing.
Dr. Robinson, did you? Sorry, go ahead, Dr. Alexander.
Oh, I agree with that. Dr. Robinson, being a local physician there in Marshfield, can have a great influence. I mean, people know him, have known him forever. If there's, like I said, any way, I know he's going to be working directly with his patients, but the vaccine is what's going to get us out of this pandemic. And we really need to get as many people vaccinated as we'll do it. So I think this, after we do our public relation thing, if there's a way that we could, make some kind of a video, or, most of the people in Webster County don't know Dr. Trotman. He's a good guy, but local people there in this committee, being composed of people mostly from Webster County, could have a pretty good influence on people. And as people, see other people getting the vaccinations and not having problems, I think a lot of the fear of this thing will go away. And unfortunately, it was politicized a bunch, and that's why we're in the mess that we're in, people not wanting to take it.
And the biggest carrot's going to be that when you get your vaccination, I know not immediately, but you're going to be released from needing to wear masks and stuff sooner than other people. And that's the carrot on the stick, is the people that are upset about what we're having to do now, that's their way out of it. I mean, I know immediately they want everyone to wear a mask, but that's going to come to where that's not going to be required. And so if you want to fly again, and if you want to go to the restaurants and you want to go back to what it sort of was before, you're going to have to take the vaccine. So the carrot is that. If we take that carrot away, it's going to be a harder sell. As far as what they're saying, even if you do the vaccine, you're going to have to wear the mask and all this other stuff still. So, I mean, I think to start with, that's okay. But later on, that has to be the goal, that you take the vaccine, you go back to a normal life.
Dr. Robinson, did we get any reports back from clinics in the county? Have you heard anything?
No, everyone's just working. I mean, we see maybe a few less requests. We were doing 30 or 40 orders for COVID testing in Springfield, and it's cut down a little bit. And the delay in the testing, especially at the hospitals, is down. Where last week we would send the order in, it might be a day or two before they even got them in to get tested. Now it's the same day. So I think it must be slowing down a little bit.
Okay. All right. Mark Alexander.
Yeah, so you guys had asked me to kind of keep you appraised of what's going on at the hospitals, and we provide a data report to the Greene County Health Department daily at 9 o'clock. So as of this morning, we had a total of 114 admitted to the hospital. 20 of those were no longer in need of isolation, meaning that they're no longer shedding virus. 94 obviously are in isolation. We have 33 in the ICU and 26 patients on vents. I have per county numbers here. So as of today, there were 6 admissions from Webster County. I've gone back all the way back to the 25th of November. We're running between 6 and 10 patients admissions from Webster County, going back that far. I can go back to the beginning, but I don't know that it's valuable information for us. We are still struggling with maintaining, staffed beds for these patients. And so we're beginning a new program today where we're going to start trying to treat some patients at home using our community paramedic program as well as our home health and home parental services programs to help manage folks that normally might be in the hospital but are less sick than those that need the beds, and so therefore we can help manage them that way. There will be other programs like this spring up around the state. The hospital associations petitioned the governor's office to have sign a waiver requiring the additional education for paramedics to become community paramedics. So we'll wait and see what that looks like. But there's, you know, it's kind of an all hands on deck approach to trying to treat people and you know, save the capacity of the health system, because that's truly when you know, the virus really starts winning, is when we can't take care of patients in a manner that we normally would. Then more patients suffer from that or because of that. So,
Mark, do you know the is Springfield doing any of the IV outpatient monoclonal antibodies yet? I saw where the CMS gave a contract for that. I didn't know if it was our state was included or not.
I heard about every third word, Dennis. Your modulation was freezing up on you. I don't know if it's bandwidth or what, but
it was the Lilly monoclonal antibody that has to be done as an outpatient, that the government's approved CVS to do it in 7 states or something. I didn't know if Springfield was going to be part of that.
I've not heard, but I'll check. Yeah, I'll check and see. I know there's some antibodies tests out there. I don't know.
This has to be given IV, and you have to do it before you go to the hospital, or they don't allow it.
Gotcha.
I took it somebody else was paying for it, maybe.
Gotcha.
It'd be good. I wouldn't know why the paramedics couldn't do that.
No, you're right. Yeah. Just have a willing doctor willing to provide the medical direction and the order sets. That's
I didn't know if the system set up to get the medicine and be able to do that yet, or if it's going to be offered this.
We've not discussed that specifically at this point.
Okay. Dan McMillan, Webster County 911.
Just to let you guys know what we try and do here is when we get a call, one of the questions that we ask is if your household has had a positive or presumed positive COVID test. And if they have, or if they advise that somebody is positive, we kick that on to the responding personnel that are going to the call so that they have the information that they need.
And that seems to have been working well. I mean, there are some obviously that we've encountered because they just simply haven't been added to the list yet, and we get called before dispatch knows their existence. But other than that, it's worked very well.
My concern is that in the absence of having that warning ahead of time, then the first responders let their guards down, and they show up in a situation where they end up with someone who does have it, even though they weren't warned, and so they're not properly wearing PPE and that kind of thing. And so it can be a double-edged sword. You know, we've had some of our cases that we've actually had staff members get the virus came from an OB-GYN case. Mom had it, but, you know, didn't pass the pandemic screening test and dispatch. Another one, we had a trauma patient that ended up having it. So our moniker is everybody has COVID until proven otherwise. And I think that's just the safest way forward.
Right, and that's something I've spoken with about to our people is we don't always know. Sometimes there's a delay in that information to dispatch, and so they know that they need to go in with PPE on every call, and that was Dr. Alexander's order for our personnel as well, and they've done really well following it. Yep. Sheriff Cole.
Afternoon. I'm not aware of anything to share per se. I can answer questions.
Okay. Nothing from other areas in law enforcement, municipal or otherwise? You haven't had any feedback?
No, not to my knowledge. I mean, we've had some people out that did have it or were quarantined or what have you, but as of yesterday, I think everybody's back to working full staffed. Obviously, it's something we worry about a lot more in the jail, but so far we've done pretty well. I will tell you, having a new facility with reverse airflow and having places to separate people makes a big difference. If we would have had this thing last year in the old building, everybody in the jail, I don't know how I could have stopped it.
Okay. All right. Did I miss anybody? I went down the list, but okay. So the next thing we had on there, we've kind of already broached the topic a little bit, is the next thing on the agenda was the current situation in Webster County. I did send that out to y'all on email. Right now we've got 93 active cases in the county. We've had 35 deaths. 1,669 people have had it and recovered, with a total positive throughout the whole pandemic of 1,797. And then we're reporting 81 total hospitalizations. We did have a test site yesterday. The National Guard came in and did it for us down at the fairgrounds, and 217 people were tested. So it's a really good turnout. So those results will be in the next few days. Anybody else have anything for the current the situation here in Webster County to add? Okay. Discussion on upcoming vaccine. That's a topic we kind of already broached. And I heard Dr. Robinson say that he had signed an agreement for storage, and that's kind of what the feedback I'm getting is that that's kind of the challenge, finding facilities that's capable of storing mass quantities and then temperatures, and that storage is going to be, at least for this first round with the vaccine that has to be refrigerated, is going to be kind of a challenge, and that maybe they were looking more towards pharmacies and other facilities that could take large amounts of the vaccine and would be able to store it and then use it within a relatively short time frame, is what I was told was 10 to 15 days. So, but I'm sure there's others on here that's got further information about the vaccine, and so it's kind of open the floor on that discussion.
Well, there are 10 places in Missouri that are storing it now that already have it. So the minute it's approved and able to be given, it'll be shipped out and started. So you have to be able to do less than -20 for the Pfizer one, because they don't want us to keep it at all. They want it used real quick. Right. So.
Okay.
And I think there's 50,000 doses or around that now. And there's 110,000 healthcare people that need the vaccine first. So I guess it will come in by the week.
Okay, so as a clinic in Marshfield, you're anticipating on having that vaccine?
They said we will, but who knows? Okay. We're all signed up, ready to go, and approved. It will come in the day they release. But they counted how many healthcare people needed, and it was 103,000 in Missouri. So I would take it that 50,000. Plus, there's some concern about everyone doing it at once. If you have a place in the hospital where everybody takes it at once, if they get the aches and chills and stuff and they don't show up to work, it's not good. So it needs to be staggered a little bit.
Yep. One of the other strategies is they're splitting the two vaccines up amongst the health systems. So one health system will get the Pfizer, the other will get the Moderna, and we're going to actually get the Moderna vaccine. I think it's come in 7 days after the Pfizer, and I think Mercy's getting it first. But Dennis is on point. I mean, you don't want everybody to take it all at once and then everybody have, chills and body aches, which are the two most common side effects, I think, from the vaccine. So, which is a good thing, according to Dr. Trotman. That means the body's developing a response to the vaccine and it's developing antibodies to keep you safe. So.
Well, one thing I was going to have the discussion kind of lead towards was a recommendation, or at least in for our report to the commission, is what our opinion would be as far as vaccination. But I think that was really clear in our earlier discussion that it seems like consensus of our group that we would encourage those to be vaccinated, to be inaccurate.
One question we had with the state was people who have already had the disease and are immune or have antibodies, do they need to take the vaccine now or can they wait? They want you to give it really, but it makes sense to me if you have, and there's a fair number of people who have antibodies already, that they don't need to worry about maybe doing it this first batch. So I don't know if Dr. Alexander and them have any comment on that, if there's any recommendations that way.
My understanding is that the people that have had documented illness will need to wait for a later round and will not be included in the initial batch, is what I've been told.
That's what I thought. When we asked the state, they said, no, don't everybody takes it. But I think they probably meant in the end, everybody takes it, but not right now.
Yes.
If you only have 50,000, you don't want to waste them.
Exactly. I went and had antibody testing done on myself just in case I was a asymptomatic person, and I am negative. And again, if there's a question, that's something that could be done. And that testing is available at each of the, at least in Greene County and Polk County, I know for sure that they do it. I'm not sure in Webster County if you have that with you through your health
and
department.
I had fairly cheap, so it's easy to do.
Good. Well, that might be something we want to encourage people and just, put out that, if you have antibodies right now, that you should still get it, but when it becomes more readily available, and cover the people that aren't protected first.
Yeah, Keith, to answer your original question about whether we encourage people to do it or not, you've heard me talk about it before, but I'm not going to encourage one way or the other because I'm not a medical professional. If my choice would be, I would call Dr. Robinson, who's my PCP, and say, Doc, what do you think I should do here? And that's where I would leave that decision. But what you may want to do is express faith in the process.
Yes.
I probably wouldn't encourage any individual to do anything on a medical level. I don't find that to be the role of us, but it is the role of several people on the board that may individually do that. But I'm not going to encourage anybody to do anything medically. But what we may say is, we know these processes happened and we support that process. We have faith in how the system was done, how the vaccine was tested. We have faith. You can put a statement of faith like that. I'm just not inclined to tell anybody individually what to do. But that's just I'm not a medical professional, so I won't be exercising,
Just
medical.
don't, they're going to turn into a monkey and they'll be happy. But I don't know if you may remember too, we're being in school in Lompoc, California, and we all had to go to the high school gym and got polio vaccinations. It was required. I mean, you got the sugar cube thing then. I mean, this is not the first time they've done mass vaccinations. And you look back in the 50s too, when people were in iron lungs. I mean, this is the same thing. So why wouldn't you want to do it? But don't. In New York City, their fire department, half of them say they're not going to take the vaccine, or at least that's what the news says.
Right. Yeah. Well, and the sheriff may have a valid point. You know, it may be better for us to encourage the process and have faith in the process. What's everybody else's opinion?
Well, come out and get your picture taken getting the vaccine, and that'll be good.
You can qualify your advice by saying, I'm not a medical professional, I don't play one on TV, but I think anyone in a position of leadership, I don't think there's really any question in the medical community that the right thing to do is to get vaccine. I've not heard the opposing views argued successfully from anyone from the medical perspective, except for those folks who don't believe in any vaccines, period. And those never vaxxers are out there.
Yeah.
But I mean, it's pretty sound.
The state said
science.
no kids and no pregnant women as of now. I don't know if they say that way. Everyone else is free.
So, well, we'll be talking about a report in a little bit. Is there any further discussion on the upcoming vaccine?
I wanted to just give a layperson's perspective and kind of join with Roy. Everybody here knows and understands that the media and their insertion in one direction or another has severely caused polarization with regard to many folks about how they feel about a vaccination or any PPEs, what have you. I think that whenever I get information from a local unit like this one, I think that local unit has credibility that other agencies or media resources don't have with our local population. So I would repeat what Roy said. I know that the medical science and the development of this vaccine has been sound and has been done in a responsible way. But I think anything that we could do and the medical professionals on this board could do to reiterate and to stand behind that process would make and give great relief and maybe permission to some folks that are reluctant out there, because candidly, I have a hard time trusting anything that I hear that comes through any media source that I don't directly know. And I think we may have all developed a more healthy skepticism than we had before. And so I see great value, even if the entire medical science has said it's good. I think that if I hear Dr. Robinson say it's good, that's way more meaningful to me than somebody that I have no personal connection to.
Right. And so this, as we said in the very first of this committee has no intentions, nor do we have a focus of trying to force anybody to do anything they don't want to do. We could come out, and everything's in the wording. We could come out and say that the medical professionals of this task force strongly encourage the shot. That leaves the sheriff, the prosecuting attorney who don't have a medical background, that leaves you open to say, you know, we believe the guys on this committee that's their life, but we're not going to put a recommendation out there because I don't have the background to do it. That kind of gives you that space there, and we can follow that up with, I have no problem putting my name on it. I will be first in line to take the shot. I'm not just going to talk the talk, I'll walk the walk. You know, I believe in it. I've studied it probably as much as any person could that wasn't in a laboratory. And I feel very comfortable with what I've been able to come up with.
All right. Anything further on the vaccine? Okay. So just COVID-19 open discussion. Does anybody have any topics that they want to of the panel members that want to talk about or bring to the panel?
One of the things is everybody set? Sheriff's Department, law enforcement, everywhere with their PPEs. Are we all cranked up and comfortable with where we should be in Webster County with protecting our staff and ourselves and all of that?
Yeah, I think we are on the law enforcement side. We've been hoarding up for a while and trying to be prepared. I think for the time being, we're in pretty good shape. The jail requires more than you would think, but we're doing okay so far. There's a lot of contacts there.
As for Marshville Fire, we're in good shape. I did pose that question out to the chiefs, and I didn't receive any response that there were needs for PPE right now. So I have reason to believe that we're solid. Okay. Anything else for open discussion? Okay. So next thing was discussion on our biweekly report. One of the functions of this task force is to provide a biweekly report to the commission, and which then may be, based on their discretion, may be sent out to other organizations and groups and government. And the last meeting, I sent out a template of the one that I'd been using to report to Marshville Board of Aldermen. Has anybody got anything that they would rather use for a different format? And if not, I was going to kind of go over a few things that I see that may want to be on that report for this Thursday. Okay, so the basic of the report would be the current situation, which current situation would include the CDC numbers, which I did send out to you today, the most current CDC numbers, the most current Missouri Department of Health and Senior Service numbers, and by numbers I mean the number of cases and the number of deaths associated with both the state and national numbers, and then World Health and what they are reporting as well, and then also, of course, Webster County numbers. That would be one of the things that we would report out. The next thing on there would be the situation regionally, surrounding counties, number of positive cases, do some demographics, cases by age, deaths by age, and then known information. For example, I would consider putting in this new report that Missouri is reporting 23,000 new cases in the last 7 days in Missouri. I would, according to a White House report, the most recent one, that Missouri ranks 5th as far as the number of, red zone, nearly the 5th highest number of cases in the U.S. Positivity rate, then we are at the 32nd in the state based on percent of increase. 91% of Missouri counties are red zone, according to the White House report, and Department of Health and Senior Services reports 62 out of 117 in Webster County for the total number of cases. Those would be some of the basic numbers that I would put out there. Does anybody think differently or want to add something else into that?
I couldn't hear. Did you say an update from the hospital beds and where they're at?
I think that would be a good plan. If that's something that maybe Mark could share with me, then we could certainly add that into the report.
That's just a limited number, so we need to know. I'd be curious to know.
And if you look on Greene County Health Department, they give you a Mark, what do they call that? A capability score, but that doesn't really give a real good snapshot of the true situation. It's just a 0 to 10 number, and maybe we could do a little better than that, maybe in this report.
Yeah, I don't have any issue with the just the straight numbers as far as what I already reported today. So if you want me to just send you an email with that stuff, I can do that. Just let you know what those numbers are. We share them with Greene County Health Department every day, specific to Greene County. So certainly being able to share it with you guys is not an issue.
Okay. One thing that the White House report did, the most recent one did say, is that Missouri has seen a decrease in test positivity in new cases, which is a good statistic. And and I've looked back at that, and so we are down from the 27,000 we were seeing in every 7 days down to 23,000. So that's a true number. So we can add that in there as well in that informational part of the report. Then far as our committee, the testing committee, we did do a test site on November 30th. We tested 114 people, 44 of those 114 were positive, and which equates at that test site to be a 38.5% positivity rate, which I think is an important number. And then, of course, the test site that I reported to you that we did yesterday, or the National Guard did yesterday, that tested 217 persons. And we might have results back in time for that report to the commissioners also. And the fact that we have another test site scheduled for December 21st from 9 to 11 at the Webster County Fairgrounds, I think would be important things to have in there as well. And then I have the important community information, that's talking about things you should do, social distancing, avoid large gathering. That's all on that report that I sent out to you if you want to look at that. County actions since the last briefing would obviously be the formation of this group, this task force. And then I put changes in Webster County statistics from the last time we reported to current. So how much the positivity rate, or the number of positives increased, the number of active cases have increased or decreased in the report as well. And then last would be any recommendations or considerations or opinions that this group might have. And that would be where I'm coming down to the discussion part of this. And is there anything that the task force would want in writing to the commissioners as regards to a recommendation or opinion? At this point, the county commission has not asked for anything to be specifically addressed. Okay, so at this point, we wouldn't have any information as far as narrative style for the commissioners. Is that accurate?
That's correct.
Okay. All right. Anything else that, I know Fred, you had mentioned some things you'd like to see in this report at the last meeting. Anything else you'd like to see added to the report that we typically have done?
I think we just covered it because, like I said, with what Mark reported today, that gives us a regional look at Greene County and surrounding areas. What everybody else is reporting kind of ties everything together with the packet that you sent out. It's going to show us our improvements or our backsliding throughout this. And then the big thing is as we formed this task force, and the commissioners said they just want to be ready for whatever could happen in January or February or March. Hopefully everything that's happening is positive and we're showing improvement, and every one of these meetings is showing our road to being over this. But I think the package that you got set now with what we just added and what we just done today is perfect for me.
Okay. So any of the panel members have anything else to add? Of course, the numbers will change between now and then, and I'll put the most recent numbers in the report versus what was sent out today. If nothing else, then do we have anything for future agenda items? Going once, twice? All right. Our next meeting date would be on the 15th, is that correct? Is the 15th, same time frame, work for everybody?
Yep.
Yes.
Yes.
Yep.
Okay, and then we are to the point of public comment. One thing we want to make sure is that we stay on point, and the purpose of the public comment is for topics related to COVID-19. And we are going to address the formation of this group as we talked about earlier. So let's keep all public comment to the purpose of this committee, which is to address the point of COVID-19. And I see Vince has raised his hand here, and I don't know what that means, but Vince, go ahead.
Thank you. Good afternoon, gentlemen. Michael, I just want to start real quick by thanking you for putting the recordings on the agenda, and I'm glad to see the task force has approved that. Quick question, then I'll move on to a more COVID-related question, but when and where will the meeting recordings be uploaded so they're available for the public?
Well, that is a question. I will need to talk to Stan, and he's not on here. If he is, I don't know it. Stan, are you there by chance under the Webster County heading? So it doesn't appear so. So I'm going to have to find out if he wants to put that on a Facebook page, if he wants to put that on the website. I don't know the answer to that question, but I will get that out once we have that question answered. But as of right now, I'm sorry, I don't know.
That's okay, thank you. Then my next question for the doctors. Let's go, Dr. Sam Alexander. Had mentioned the early, let's see, what did he say? He said the early phase processes for testing the vaccine, or he mentioned the early phase processes, said a lot of them were done simultaneously, and that's the reason the vaccine was able to be pushed out so quickly. Dr. Alexander, did any of those early phase processes include a double-blind placebo test?
Yes, they do. All of the testing that were, regardless who was doing it, there were double-blind studies. Yes, that
All
is
of
the
them?
scientific method. Yes.
Can you reference
I wasn't the one.
studies?
I wasn't the one that made that statement earlier about things being done simultaneously. I can't remember who said it, but I'm answering from what I know. That yes, it did require. There was double-blind studies. I actually was offered a chance to be in the study, and I did not get my email. I'm kind of a caveman as far as stuff, and I would have actually volunteered to have been in the study. And it was done 50-50 with people that would be getting the vaccine and people that would be getting a placebo. And that's how all scientific methods are. And yes, that was done in all this testing.
Sorry if I named you on accident. Maybe it was Dr. Mark. Is he still in here? I'm not sure.
I can't remember. Someone said it. I heard what you said, and that's fine. I'm answering it the best that I know how, but I did not say that.
You saying there are double-blind placebo tests? Because I'm not aware of any of those, so I would like to view those if they're available. Are you aware of any specific studies?
I'm not aware of the site that you go to, but I do know that that's the way that's the testing of effectiveness on anything is double-blind studies, and I know that it was done in this. A person ought to be able to find that through the company's websites. Both that should be available through them. I'm not real techie at being able to look stuff up.
Will the task force be putting out some of that information to provide public assurance? And did any of those?
I have no problem with doing that. We should be able to come up with something. I've got people that are real good at looking stuff up like that. So if that's something the task force wants to do, I mean, we could try to do that to allay people's fears.
Yeah, that would be much appreciated because I'm not aware of a double-blind placebo study. And if we could get that information, I think that would help people a lot. Did any of those processes include long-term efficacy or long-term safety studies?
That I can't answer. I know the short time involved with this, but from what they've seen, these studies got started back in March. They were starting to already enroll for these. So, you know, we've got from March until now. So we're talking 12, we're talking 9 months. So long-term, no. There were some studies that had already been done, and the reason we were able to get some of these things out as quick as they did is they were actually looking at MERS, which is a very similar virus. It's in the same family. It's in the coronavirus family also. And there's research available from that. And again, that's part of the reason this was able to proceed as quickly as it did, because there was already experiences with that. But again, as far as details and stuff, that's something that about anyone that's good at looking stuff up should be able to pull up.
Okay. Keep looking then, but hopefully I can hear something from this task force to point me in the right direction to find some of the studies related to these current vaccines that you are supporting.
Was the Middle East respiratory syndrome that fortunately didn't really spread widely. But again, that's part of the reason that this things proceeded as rapidly as they did. So that would be, again, something you should be able to just look up and find information yourself. But I'll put my people.
Well, I'm familiar with MERS, and I know that there were rudimentary sort of trials for MERS and SARS vaccines that were some of them provably dangerous. But you know, when COVID began earlier, when it reached the United States or shortly before, earlier this year, 17 labs launched programs to develop vaccines, and as far as I know, they're all still going, and they all still plan to hit the market. You know, I think there's 3 different categories of this vaccine, and they're all making some variation of one of those categories. But you know, we didn't have those 17 vaccines before any of this started, so there's a lot of questions that need to be addressed, and it's hard to, you know, for the public to get on board with the faith that this task force has in those vaccines. But I won't take up everybody's time. I just have one more question for Mr.
Hey, one thing on there.
Bergstresser.
Hey, Vince, one thing on there too, maybe I can come up with a bunch of the points that I found and send to you on SARS and MERS, and talking about the 80% comparativity between SARS and there. I read a whole bunch of studies when I was talking about earlier before I listened to Dr. Troutman's video and some of these other guys that are way more up to speed on this than me. But I found tons and tons and tons of information just by searching for basically SARS and COVID, or Mars and COVID, and then go through and read a lot of the literature and studies. That's, as Dr. Alexander was saying, that's how they got so fast on this, was that there's about an 80% comparability between SARS and COVID-19. So when you're 80% all the way, when you're 80% there already, that's the only way we made this happen. They made this happen in 10 months time. So, but that's one place. And if I can come up with any more that I remember, and if I can find my notebook where I wrote down some of the notes, I'll send some of the links that I had to you too.
They also used already approved delivery methods. So the delivery method for the vaccine is crucial, and a lot of times they have to produce, or choose to produce a different delivery method, which then has to be approved by the FDA. So by using methods that had already received FDA approval, they were able to shorten the time span for getting the trials going. And so.
Okay, thank you. And thank you, Mr. Savage. I would like to take a look at anything and everything the task force is basing their recommendations on, and I think a lot of people would as well. I just have one more thing to address with Mr. Bergstresser. First, what is he still listening?
Yes.
Yeah, he's here. Okay. Mr. Bergstresser, what statutes are governing this task force?
This is the commission's plenary power to appoint committees and task force to assist them in doing their job. So it would be, I forget what chapter it's located in, but it would be the chapter that authorizes county commissions. And I'm sorry, I don't have that, Mr. Sobers, but if you gave me some short amount of time, I'm sure I could give you something more specific if you would prefer.
Yeah, if you could, that would be great. Thank you. Now that I do think I've come across that statute recently, and it kind of rings a bell. But I also think that just referred to the formation of a committee, right? Are there any statutes that define the authority of the committee?
I think that the authority of the committee is limited to whatever is authorized by the commission in creating the committee. So whatever limitations there are on the commission would also apply to your task force that they would appoint. And if there are further restrictions or limitations, that would be included in the commission's initial decision to appoint the committee. And of course, looking at the mission statement, I don't know how much, I just received that today, and I don't know how much input or where it all derived from. I will be getting to that, but I did want to say that that the limitations are certainly within whatever is given to the commission at large, and then the commission can further limit that task force so they can't act but only by, with, and through the authority and power of the commission.
And will any of the commission's authority expand beyond county lines as some of the members of the commission have the authority of their positions in multiple counties?
No, that this is restricted only to Webster County as the authorizing agency.
Okay. So because the commission brought you on, were you invited, or did you ask to join the task force?
I was invited on.
Okay. Does the task force face liability for their claims about the vaccines?
The general answer is no. Of course, we're not developing any vaccines. Those would have been developed by other companies. And of course, that's outside of any information or knowledge that I have. Outside of that, each doctor who would make any recommendation or not has that liability. I don't think that the county is going to get in the position of making anything other than recommendation to seek advice from treating physicians and knowledgeable medical personnel in making that decision. Now, to get straight to the point, because I am here because I believe that it's always possible, especially in this new era, for there to be liability issues that we don't foresee. And I don't have any particular crystal ball to look and see where they're going to be. But generally speaking, a government entity doing its job and serving people has a general immunity that protects them from most liability circumstances. Of course, there are exceptions. I don't know if any exceptions are going to have any applicability to the current process, but I'm here to help with identifying those if there's a possibility and finding answers to direct and help provide some sort of strictures for the committee task force to act, so that we do it responsibly and we do it within the confines of the law, in helping to protect people, but also not creating an opportunity for liability coming back on ourselves. That wouldn't serve no purpose.
Yeah, sounds like a good reason to have you around. Are you aware then of any conflicts between the authority of this committee and the authority of the committee that is under the health unit board?
I'm aware of no conflicts.
Okay.
Okay.
So one of the ground rules is that we were going to stay on COVID-19, and we've varied way away from
Yeah.
that. Vince, do you have any questions about COVID-19 specifically?
No, that was my last question. Thank you.
Okay, thank you. Okay, is there anything else from the panel? All right. Well, is everybody in agreement with adjournment?
Agree.
All right, very good. Thank you, guys. I appreciate it. Everybody's input, and we'll be back here at noon on the 15th.
Can't wait.
See you guys.
Yeah.